evening. Welcome to Soundhealth on Lagos Television. I am Ola Sumbo Mudupe. It is 1 year since President Bola Tinubu assumed office as the president of Nigeria. How has the country fared in the health sector? This is our focus today on the program. The conversation begins after this break. Please stay tuned.
I would say there are three kinds of health emergencies that can be triggered by climate change. First is those direct emergencies, heat waves, wildfires, floods, droughts and so on. The same burning of fossil fuels, which is driving the climate crisis, also contributes to about 7 million deaths a year that we suffer from air pollution. Climate crisis is undermining all of the environmental determinants of health. It's making it harder to provide water and sanitation or food systems, and it's actually rising sea levels, which are making some parts of the world uninhabitable. In fact, the most common form of health emergency, the most deadly form of health emergency that we have now is extreme heat. And the climate crisis is only making that a much bigger problem. Often that's in the form of providing relief after a population is hit by a flood or a storm or a drought. But what we're also having to do is to support countries to make them resilient to repeated events. So we're having to build in long-term resilience to the health threats presented by climate change.
Still Soundhealth on Lagos Television. Joining us via Zoom this evening is Ayo Adebusoye, Chairman, Board of Trustees, Public Health Sustainable Advocacy Initiative, and he is going to share his thoughts about the current administration, how the current administration has fared in the health sector in the last 365 days. And we'll also try to look at activities in the health sector in Lagos State as well. Good evening, Ayo Adebusoye, and thanks for joining us.
A pleasure to be here.
All right, Ayo, thanks for finding time to join us on the program. Let us look at the agenda of this current administration. Has it resonated with the health sector like other sectors?
Thank you very much. Well, of course, the Nigeria Health Sector Renewal Investment Initiative, which was the first sector-wide approach with Nigeria, was launched by the Coordinating Minister for the Health and Social Welfare, Professor Mohammed Ali Pate, which aims to enhance efficiency and alignment of spending with strategic priorities in the health sector. And that is crucial as demands for increased funding for the health sector. It has so many inefficiencies. So I think one of the things is that, yes, at that level of policy, those things are in place, but now we need to start looking at implementation, because this is now like 2 years since the National Health Insurance Authority Act has been promulgated, which makes it mandatory for every resident of Nigeria to be covered by health insurance. And we need to look at 1 year after the new administration has come in, how much have we moved the needle? I think that's something we really need to ask, because it's one thing to have the laws and the policies and the strategies in place, but it's another thing to actually implement. And government needs to look at the health sector not from expenditure point, but investment. We should look at this as investment, that is why it's called the National Health Sector Renewal Investment Initiative. In the sense that once, even the World Bank have shown that with studies, they've seen with what has happened with over the past few decades, with the Asian tigers, Malaysia, Singapore, etc., Indonesia, that by the time there was investment in human capital, especially health and education, we saw that there was a corresponding growth in the economy. So we need to look at policymakers at national and subnational level and at the local government level, need to look at health from the point of view of investment. And one of the challenges we face sometimes is looking at health just from that federal level. The real interventions for health happen at the state and local government level. Don't forget that the private healthcare is actually one of the constitutional mandate of the local government. Where, of course, there's a discussion about how much autonomy should be given to the local government now. But we see that from the federal level, there is a limit to what they can do. They could have various regulations in place, but implementation is not the federal government that will do it. So what the federal government has the power to do, one, is to ensure that, one, the Basic Healthcare Provision Fund, which is also in the National Health Act, is actually being rolled out. There's provision for it, and also there is actual release. This year, we have not yet heard of the release of the Basic Healthcare Provision Fund, which is supposed to go to all 36 states and the FCT. These are the things that the federal government can do. Two, there's the Vulnerable Groups Fund, which is in the National Health Insurance Authority Act, which makes provision for the most vulnerable, for the insurance premiums to be covered by this fund, those vulnerable groups in Nigeria, including persons with disabilities. So far, we haven't heard anything because there's going to need to be a governing council for that, for the National Health Insurance Authority, which we have not yet. It's been inaugurated yet. So there's a lot of things that the federal government of President Bola Tinubu needs to put into place so that these very, very high flying policies, laws, provisions, structures can actually start to work. And here we are about to enter June, and it's still not in place. I think they need to speed these things up because these are the most critical areas where you can have impact in the economy, ensuring that everybody has access to health insurance, ensuring that there is financing of the health sector. For decades, we've been all talking about how Nigeria has still not, especially at the federal government level, been falling short of the Abuja Declaration. The African Union countries all agreed, we remind ourselves again, that in the year 2000, that there should be 15% of the budget allocated for health. And it was signed in Nigeria, in Abuja. That's why it's called the Abuja Declaration. But since then, Nigeria has fallen way short of that 15%, sometimes going to 5%, 4%. So even just in those terms, we see that there's still a lot of work that should be done by the present government to ensure, despite, yes, we know there are conflicting priorities which government has to take care of, but we need to know, as the example from COVID showed, that the health sector, when everything else fails, the health sector must be running. We must make sure that we can start to renew this health sector. The health sector is in crisis. I think we all know that, and that's why many of us have been saying that, look, there needs to be a total ban of public officers, especially for political office holders, from traveling abroad for any health needs. Then they will begin to prioritize our health sector. We cannot continue to have this hypocrisy where those who are at the helm of affairs are ready to travel abroad for the slightest headache or any ailment, while the rest of us here languish. So I think it is important, this is an important time, first year anniversary of the new administration, to take a stock taking about how much of things that are even already in the law, the laws which the federal government themselves formulated, how much of them have they even begun to implement? Thank you.
I'm glad you mentioned that we are always fast to come up with policies, but we don't look at implementation. We don't even review those policies. Now that we have the renewal compact in place, policy in place now, what do you think? Do you think it is right for the government to bring together development partners, the federal government, the 36 state governors, to ensure that this works? Or do you think we should just decentralize the whole process, or yes, the structure in place to have a better result?
Yeah. So it's not either or. In fact, you need both. So actually, you need one, to have all the partners in place at the federal level coming together, both the development partners, the various MBAs, ministry department agencies at the national level, and representatives of the subnational entities to come together. But we also need to prioritize the actual implementation at the state level. There needs to be more stringent monitoring and evaluation of the funds that are going to the health sector at the subnational level. For instance, basic health provision fund, at least they've rolled out a few times. We need to evaluate now what has been the impact on the citizens in those places where it has been rolled out, the facilities that has rolled out. What's the accountability framework to ensure that we can actually see that we're getting value for money? The health sector generally, and even at the federal level also, has one of the lowest budget utilization. So apart from the low budget performance, even utilization is an issue. And there's so many aspects of the challenge. Starting with delay in fund releases from the Ministry of Finance, and of course, there's over-dependence on donor partner funds. And we see that, especially like in COVID, we saw that you cannot rely on foreigners for your health. All of them took care of themselves first, even procured COVID vaccines for themselves. And it was until they had so much glut before they now remembered, African countries. Thank God for South Africa that were even in the lead of trying to even start to manufacture COVID vaccines. So that's an example of how we have to become self-reliant. We must prioritize research and development of our own products, medical products, of our own vaccines. We cannot continue to rely on foreigners for our health sector. There's a lot of programs that we have, HIV, malaria, etc., which will collapse totally if foreign entities like Global Fund, etc., pull out. That is unacceptable. These are the priorities for any government to come up with. The health sector, if we can just begin to look at what are our own commitments, the commitments we have made. Don't even think of anything new. Commitments we have made. Let us start to follow the commitments we have made at the federal level, state level. That's why, like you said, bring all the state personnel together and the local government. Now, this is one of the keys that we need to look into as we're speaking about autonomy. The National Health Act speaks about the local government health authority. How functional are these entities, structures, anywhere in Nigeria? Are they in place? Are they functioning? Because the local government that will bring ownership, especially of primary health care, to the people. If we just have big programs at the federal level in Abuja, it's not going to cut it. And that's why we see that even after so many years, for instance, huge investments in HIV, huge investments in malaria, we see the poor indicators that we have. So I think it's something that we need to understand that one, self-reliance. We even need to look into our own traditional alternative medicine, because even in many other climes, in India and China, we see how they've developed the alternative medicine, complementary medicine, to actually face the issue of health outcomes. We know how many people in many parts of Nigeria, their first point of contact is the traditional medicine practitioners. Those things need to be standardized, regularized, and supported, because they have a wealth of experience which needs to be inputted into our health system. And I think one of the things we need to realize now that we have a lot of wealth of resources, traditional resources, the ones that are available, and we need to begin to use all of them, because this is an emergency. We still have one of the highest maternal mortality rates in the world, the highest child mortality rates in the world. These are no prime indicators to know what is the level of our health system, and it need not be so. And it will continue unless we start to think differently about what we are doing. And one of the things that we can't overemphasize, it needs financing. Financing, we have to think of innovative ways of financing. It's not just to wait for federal government alone. We need to think of various sources of income to ensure that every Nigerian gets coverage of basic health care.
But we are also hopeful that now that we have the local government autonomy, advocacy for local government autonomy on the eye, we are hoping that things will get better. There's still high rates of out-of-pocket spending for the not to have, not to reach, below the line, people below the line. What do you think the government can do differently now? Because the deadline for the universal health care coverage is close by. What do you think can be done differently moving forward?
Yes, as you said, for instance, in Nigeria, estimated 70% of health spend is from out of pocket, which is completely unacceptable, and that's why we see a very high mortality rates for things that should be taken care of normally, like maternity, which is a basic thing. Because so as soon as you get to the hospital, you have to pay, even in government hospitals. And how many people can afford to pay? And that's why the aspect of the National Health Insurance Authority Act came in, where every Nigerian is meant to be covered by some health insurance scheme. And that's why it's also provided that every state should have a health insurance agency, which would actually be the one that would actually push that. We need to understand that health is something that needs an investment. What we need to do differently is ensure that we start to kick off all those provisions in the existing laws, and if it's not there, make sure that it's included, where the most vulnerable premiums are covered. Just like we have the Basic Healthcare Provision Fund at the federal level, and in Lagos State, we have the Equity Fund in the Lagos State Health Management Agency law, which prescribes that at least 1% of the Consolidated Revenue Fund should go to cover the most vulnerable persons, their premiums. And that's why we also have the Vulnerable Groups Fund, which we refer to at the federal level. So we need to just actualize these things. That's the thing we need to do differently very fast. So ensure that the premiums are paid for the most vulnerable who cannot pay. And then those others, we need to ensure that those who can pay, they are made aware, because it needs a mindset change. It needs, it's something which we're not really used to. The funny thing is that we're used to insuring our cars, but we're not ready to insure ourselves. So government has to come in with the enforcement, compliance, to ensure that people begin to take their own health seriously. In other climes where people go, there's some form of either health insurance or health plan, health system that backs up every citizen. We cannot allow citizens to die just because they can't afford money at the point of service delivery. And that's one of the main things about universal health coverage, and why it has to be affordable, it has to be quality, something that people can actually access. And the best way is ensuring that our health insurance programs are working. Now, one of the things that should be done very quickly at the federal level is ensuring that the Governing Council of the Health Insurance Agency, the Health Insurance Authority, is inaugurated, because they are the ones who actually have, by law, have the mandate to make all the policies and all the regulations with regards to the Vulnerable Groups Fund. And it's not a 2024 budget, because that council has not been inaugurated. So that's one of the things that the President, Bola Tinubu, should ensure that he can do. This is something he can quickly do. The Minister of Health should prioritize, bring it up, at ESCO, to make sure that this is done rapidly. Because that is something that will have far-reaching effect. We're talking about palliatives, persons are feeling the pain. This is one thing that if the government does this at the federal level and the corresponding states, the common man in the streets will feel that something is being done for their existence. So this is the thing that can be done differently, which will change the narrative. We see, for instance, in Lagos, we have the Ilera Eco Health Scheme, social health scheme. We see so many testimonies of vulnerable persons, middle-class persons, who took advantage of the health scheme. Either they paid their premium or they had to pay for by government, which made sure that they could have some operations which they will have pay hundreds of thousands of naira, and which the premiums are taken care of. Many testimonies. So we need to begin to look at this very, very critical aspect, which is already available, but just needs that push by both the federal and the subnational governments to ensure that it is properly funded. The health insurance schemes are funded for the most vulnerable, to take care of the premiums of the most vulnerable. That's one way that we can change the narrative. We can't overemphasize this enough.
Ayo Adebusoye, Chairman, Board of Trustees, Public Health Sustainable Advocacy Initiative. Thank you so much for your thoughts on the health sector in the last 1 year under President Bola Tinubu's administration. We'll bring you the concluding part of that interview next week. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We now take a look at World Menstrual Hygiene Day. Stay tuned. This is where we say thank you on today's episode of Sound Health. We believe your hope has been renewed after listening to Ayo Adebusoye, Chairman Board of Trustees, Public Health Sustainable Advocacy Initiative, on how to move the health sector forward for the populace. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.